Welcome to the Sultans of Sales podcast. I'm your host, Jameel Pendleton. Thank you for joining. Today on the show, we have spine surgeon, Dr. Peter Derman. Dr. Derman and I got together 2 months ago in his office at the Texas Back Institute, and we had a fantastic discussion. It was so good that I asked him if he would join this podcast so that we can share some of the pearls and some of the things that I learned that day with you. And fortunately, he agreed. So Dr. Derman, thank you so much for joining. Welcome to the show.
Thank you. Thanks for having me.
Absolutely. You know, one of the things that I really loved about your story specifically was kind of what drives you and why you do what you do. And I think that whether it's your history at Stanford as a competitive gymnast or, you know, today, is there something that from an early age that you found that allows you to find that extra gear? I mean, you've been very accomplished in your young career.
I think that it's just doing things that I'm passionate about. And, you know, as you kind of alluded to, I was a competitive gymnast for a long time, 17 years, all the way through my time at Stanford, where I was the captain of the team. And I was really passionate about gymnastics. You can't tell based on this podcast, but I'm not the tallest spine surgeon around. So clearly basketball wasn't in the cards for me, but my parents enrolled me in just recreational gymnastics at a very young age. And I was good at it. And I was really passionate about it. And, you know, people often say to me, oh my goodness, that's such a tough sport. Were your parents those like crazy parents that like forced you to do it? And it was quite the opposite, actually. You know, you always have these ebbs and flows and you get a little burnt out. And my mom was always like, why don't you quit? Why are you doing this? But, you know, I loved it and I wanted to be the best. And that's what pushed me through. And it taught me a lot of lessons about really how to manage my time and how to be efficient. And when you're working out, you know, 6 times a week from the age of 7 years old, you don't really procrastinate ever. And so that has been imprinted into my DNA. You know, there's, you know, don't do something later that you can do now. And so my wife says that I don't relax well. I'm always looking for my next project. And, you know, so phase 1 of my life was really gymnastics. And then phase 2 became spine surgery. And that was the next thing that I was passionate about. And I dedicated myself in the same kind of way that I did to gymnastics to learning how to do spine surgery and particularly minimally invasive and endoscopic surgery.
That's fascinating. What about do you take some things that you learned from gymnastics? I mean, you mentioned the do it now mentality. I wear this on my,
there you go. Perfect.
My dad gave me that and I'm finally doing things now. But do you take other things, maybe the principles of movement or, I mean, for your patients and in your practice? I would love to hear kind of any overlap or parallels.
Absolutely. I think there's so many similarities. One part of it is the team aspect of it. And, you know, spine surgery and surgery in general, the surgeon is supposed to be like the captain of the ship or whatever. But really, there's a whole team that's just as important. And you're only as strong as your weakest link. And it's all about building that team and supporting that team all the way through, both in the operating room and then in the clinic side. So everyone from my medical assistant to the front office staff, to the call room staff, to my scheduler, they all have to be on board and as passionate as I am about providing excellent and high quality care to our patients. And so the things that I learned from being in the leadership of the gymnastics team, I have parlayed into, you know, leading my team in the operating room and outside the operating room. And that's about respect and talking to people like they're people. It's not rocket scientists, but, you know, you just lead by doing and being a good example and enabling people and rewarding them when they do the same. So that's one side of things. And then, you know, from the actual technical side, there's so many parallels between gymnastics and I'm sure other sports as well, but gymnastics being mine, and actually doing the operations. You know, I joke that for 17 years in sport, I did my best to not paralyze myself. And now I'm doing my best not to paralyze somebody else. But it's still high stakes nonetheless. And so I prepare, my pre-game routine is almost identical to what I used to do before a gymnastics meet. I go to bed early, make sure I have good sleep. I eat, a good breakfast. I drink just the perfect amount of coffee, not too much, not too little. And then I visualize before all of my surgeries. So actually on my drive in the morning, I'm walking through each step of each procedure in my mind, even though I've done them numerous times, just to get the muscle memory ready so that my body is primed. And there's good studies to show that this is effective in athletics and outside of athletics, because you get your mind in the right setting. And then once I get to the OR, everything just kind of flows. I don't have to think, hey, what's next after this? What am I doing here? My body just kind of does the thing, and you get some good outcomes that way.
I'm so glad that you talked about visualizing your success or your steps of the procedure, because I feel that separates the good from the great. And athletes do it. And you mentioned in gymnastics, I did that in my soccer career or baseball. I feel that that's such a key element. It's simple, but difficult.
Yeah.
Right.
You have to set aside the time to do it. And it seems kind of silly, like to walk my mind through the steps of a microdiscectomy, which I do many a week. But it's almost like meditation, and you got to get your mind in the right spot. And I think if you take yourself and your job seriously, then it's the right thing to do.
That's awesome. So let's talk about your practice. You mentioned doing a lot of microdiscectomies. You and I have connected on a few areas of interest that you have, endoscopic surgery, right? So can you, maybe for the audience who's I would imagine be a mix of some people that understand this and some people that don't. So however you'd like to tackle that one.
Yeah, so I have 100% spine practice, and really my niche within spine is the minimally invasive and ultra minimally invasive. So my goal is always to address spine pathology, spine issues, using the least invasive way possible, which enables my patients, probably about 80-90% of them, go home within a couple hours of surgery, and get back to activity quicker with less need for pain medications, time off of work, et cetera. There's a variety of different strategies. So, minimally invasive, this term gets tossed around a lot without a whole bunch of meaning, basically. Really, anybody who makes their incision 1 millimeter smaller feels justified in calling themselves minimally invasive, which is not, in my opinion, kind of the real deal. What really minimally invasive means is not just making smaller incisions, although I pride myself on making really small incisions, but it's what happens under the skin that's important. And really that boils down to not cutting or damaging the muscle or soft tissues that stabilize the spine. Well, think about the spine. Oh, there's the bones and then there's the discs, but actually there's all these muscles and tendons and ligaments around the spine. Right. And the traditional way of getting to the spine involves making a big incision and then literally burning and stripping those tissues off of the spine. And so what you don't see on the x-rays afterwards is what you do see is, the carpentry that's been done, but what you don't see is all the damage that's been done to get there. And so that's really the key. And there's different ways of there's different means of getting to the spine minimally invasively. And that depends a little bit on the nuances of what problem we're trying to solve. But the key, again, is never cutting muscle. And so, like, for instance, I do a lot of my work through these little tubular retractors. They just go between the muscle. And then, as you mentioned, I'm really passionate about endoscopic spine surgery, which is kind of the next iteration of minimally invasive. It's being called ultra minimally invasive. And what it is, shoulder problem, or you had a knee problem, say a rotator cuff or a meniscus tear. Previously they would have opened up your shoulder, opened up your knee, and sewn things up and cleaned things up, and then closed you back up. And as we know, there were reasonable outcomes from that, but there was a big recovery associated with it. And now, if somebody said they were going to do that to you, you'd be like, what the heck? You go get your shoulder scoped or your knee scoped. That's right. And so the analogy is that you can now scope a spine. So rather than open things up to the world, big enough that I can peer down with my eyes and see the spine through a little 8 millimeter incision like this, I'm able to insert a camera just between the muscle fibers exploiting existing openings in the bone so you frequently don't have to take any bone at all, to get down, watch the whole thing on a big high definition screen. And then I can address various spine issues through these little 1 and 2 millimeter instruments that I can use through the camera. And the outcomes of that are just phenomenal. I mean, the patients are up, walking around and home within a couple hours, and most of them don't even take, Tylenol or anything else afterwards.
That's truly incredible. I mean, a couple of things that I'd like to highlight there. The importance of getting them up and moving right after surgery. We've seen that across my career, 13 years in this industry, working with surgeons like you. And it's really important in terms of their long-term, short and long-term recovery to do that. And I feel that COVID was a lot of things for a lot of people, but it sped up some trends that were already happening. And one thing in particular is kind of that migration toward the ambulatory surgery space.
Yep, I totally agree. And I think that, it's not just about like pushing the patients out faster. It's about modifying your surgical technique as well as the preoperative, intraoperative, and postoperative processes that allow for safe discharge.
Well said.
So my patients, and it's not like I invented this, my patients get a preoperative cocktail of Tylenol, gabapentin, sometimes a long-acting opioid for my larger cases. And then intra-op, we do local anesthesia, we do regional blocks, and then post-op, we have, another cocktail. All of these things, it's called multimodal analgesia or anesthesia, in order to, make it so they're more comfortable and need less narcotics after surgery and are able to get up and out of the hospital. So none of my patients post-operatively get IV pain medications, regardless. Wow. And that's what allows them to, move around and go home. I tell my first endoscopic patient of the day, we'll get this done and I'll get you home for brunch. Which is pretty cool.
That's amazing. I mean, those things matter, right? If my friends and family, they don't truly understand this world, right? But if you can tell them those things, like, hey, you'll be home by brunch, or you're going to get up and walk, and this goes back to what you talked about. I feel as the team that you've, so that takes a team of anesthesiologists, of CRNAs, of the staff, of the pre-op nurses, and your surgical team, right, to understand, right. It's all a process, and you're the captain of the ship, but there's a lot of people helping drive that, ship forward. So.
Absolutely. And the key is like to give them ownership. So for instance, my surgical scheduler, she does all this work on the back end before surgery, interfaces and fights with insurance companies. And then the patient goes to surgery and she doesn't necessarily ever hear anything from them again. Right. And so I go out of my way to give her feedback like, hey, so-and-so, did great. And they actually mentioned how grateful they were for all the things that you did for them. That gives her job meaning. Same thing for the PACU nurses. They see the patient immediately after surgery, but they don't get the long-term. So oftentimes, the next week I'll go back and say, hey, we saw so-and-so back. I know you took care of him after surgery. He was back at work the next day. He's so grateful. He had great things to say about the care that he got. And that, that gives them kind of the 30,000 foot view of the important job that they're doing for our patients.
That's fascinating, Dr. Derman. You're closing the loop, right? Because these people that you're mentioning, they're a part of that loop, right? But they don't ever get to see either the beginning or the end. They're just there for their part. And, for me in industry, that was always the most fulfilling part of my job, because most of the time, most of the cases, we come in, they're draped, they're positioned, and the procedure's underway. And we're not involved in any of the pre or post-op discussions or care, nor should we be. But it's awesome when a surgeon like you goes out of their way to share, hey, Jay, remember that patient that we did? They went home the same day. They're back at work playing with their grandkids, whatever it is, because that's the fulfilling part about medicine.
Right. How could you not be excited about your job when that's what you get to do for people?
Right.
I mean, I think the best job in the world. It's just so rewarding to have a person who has a problem and then help them feel better and get back to their lives. And I just try to share that with everybody else so that they'll be excited as well.
Two final questions. I know we're running up on time. So you mentioned that you're a problem solver. And I absolutely agree. As an industry professional, it's been, over the course of my career in relationship sales. So it started almost 20 years ago, but now in this space for a long, long time. I think when that for me unlocked, that I don't need to tell you about my lordotic cage angles or my different tools. What I need to do is understand what problems you're trying to solve, Judy's leg pain, right? And how maybe some things that we have can be a helpful solution to add to your arsenal, is so to speak, or your, just an arrow in your quiver of treatment options for those patients. And I think that once I understood that, it was a partnership. It was a conversation between the surgeon and the industry rep, not wearing a red hat, standing in the room, checking a box, right? It's a mindset shift. What are your thoughts on our relationship industry with the surgical professionals?
Yeah, it's a tough job, I'm sure, to be a rep. When I first started my practice, I got a little taste of cold calling, and I had I'm in Dallas. There's 300 spine surgeons here, and nobody knew who I was, and so I would just go to random medical centers, take the elevator to the top, and walk every single floor all the way down, walking into random doctor's office, say, "Hey, I'm Peter Derman. I'm a spine surgeon in town," and you get a lot of doors closed right in your face. So I can definitely relate in some respects. What, in my mind, what a rep has no control over essentially is their product, right? So you got what you got. I guess you could go to a different company or something, but within your current armamentarium, you've got what you got. And so, educating the surgeon on what you have is one part of it, although that takes 2 seconds. Like, you could show me a picture, like a 2-second brochure, and I can see like, hey, I'm interested or I'm not interested. But if there's something interesting there that fits into, my workflow or my processes, the most important thing is actually the service that the rep provides. Yes. And so I have been in situations where there was a great technology that I wanted to try, and I, spoke with the rep from that, and we did the case, and the rep did not show up prepared. Let's say that. Mm-hmm. And I'll tell you, that was the last time I ever, or probably will ever do that. Because ultimately, you can have a great technology, but if you don't have, a dedicated, knowledgeable, reliable rep supporting that, then it's not safe for the patient, and it's not worth it. There's a lot of good things out there. And so, and then the flip side of that is, a lot of these products, and maybe people don't want to admit it, are commodity products at this point, right? Mm-hmm. So like, there's 1 million PEEK cages, there's 1 million titanium cages, pedicle screws are pedicle screws. So really, the way to differentiate yourself as a rep is somebody who's knowledgeable and is always there. And so the reps that I work with are phenomenal. They're like everybody else on my team, and they're part of the team. I update them after the cases too. Love it. Because I have so many things to worry about in order to do a perfect surgery for a patient. And I want somebody who is as anal and focused on these details as me, somebody who's thinking about the case, several days before and texting me, "Hey, what do you think about this? We have this." Just the fact that they are as concerned about the patient and the case as I am takes something else off of my list of things to be worried about. So that's what I'd say. Preparation, knowledge about your stuff, having a plan B, a plan C, even if I don't ask for it, so that, we're not on an island in the OR if something were to go wrong. Those are the things that really reps and make them invaluable to my team.
Thank you for sharing. Thank you for sharing in depth, because I love the parallel that you have with the referring physicians. I mean, that's some acute, that's some just intelligence right there that you're sharing, because you've been there right in the early stages of your practice. And I think that's a great lesson, and hopefully people listen. So we're almost there. I want to be respectful for your time, Dr. Derman. Thank you so much for joining. Final question. What do you want your legacy to be?
I want my legacy to be a physician, not necessarily even a surgeon, that cares about his patients and helping them get better. And so in some ways that means, the surgical side of things and being a skilled, minimally invasive surgeon, but really putting the patient above everything else. So, that's helping them with physical therapy and avoiding surgery, or honestly, if they need surgery and I'm not the best person to do that surgery, making sure they get to the right person. So, just treating everyone like my family and prioritizing them as a person above everything else. Then, there's academic things, teaching things, and those are important to me as well. Just kind of advancing the field as a whole, again, to make things better for everyone. That's kind of the professional legacy. And then, I am a father, I am a husband, I have 2 young sons, and it's interesting how your life really changes when you have kids and it rejiggers your priorities. Previously I could work, nonstop for weeks on end without looking down. I just put my head down and work. I don't care. But having kids and a wife really kind of changes that. Not that I can't work all the time, but I have to make time for them too. So it's important to me that, I give them the time that they need and that they get dedicated time and help my kids grow up and be good people also.
That's wonderful. And it's beautiful. And as a father of 2 boys as well, I mean, it's just you're the mirror, right? So they're going to see what you do and how you prepare, kind of that, all the things that you talked about at the earlier or point of this episode, and they'll learn from dad, right? And they'll love to do things kind of the way that dad did. At least that's what I hope. And
my 3.5, I have a 1.5 and a 3.5, 2 little boys, and my 3.5-year-old, he wants to be a spine doctor when he grows up, although that's the only job he knows, I'm pretty sure. So, but right. His plan is he wants to make popcorn for the patients after surgery to help them feel better, which is like so nice. He's that's like beautiful. Already thinking customer service minded. So I'm proud of him.
Yes. That's a servant's heart right there. That's amazing. Thank you for sharing that. So what I like to do, if there's time, is give the guests on the Sultans of Sales show an opportunity to ask me a question or to share. You don't have to ask a question. You can share anything that's on your mind that you'd like to promote or to talk about. So just wanted to give you that option, Dr. Derman.
I think the biggest thing that I'm excited about at this point is the endoscopic technology. And so I encourage anyone who's interested in spine to look at it. You can go to some of my social media sites or other people's and learn more about it. I think it's really a game changer. And if you're looking in what direction is spine going in the future, whether that's as a patient or a surgeon or industry, I think that is clearly going to be a big part of what we do. And, I'm happy to be a part of the major wave of it going forward.
It's awesome. And I have absolutely seen your presence on social media. That's how we connected, even though we're both from Dallas, two kids from Dallas, right? That's what we were laughing about in your office. And it's fun to connect via these digital channels. And ironically, I'm just down the tollway from you today in Dallas for some meetings. But thank you so much for joining the show. This has been, for me, fascinating to hear your story again, and with a little bit different lens and more clarity this time. And so I really appreciate you sharing those things and taking time out of your day. It means a lot.
I appreciate you having me. It's, I'm passionate about these things. I could talk about this stuff all day. So it's always fun to let a little bit of it out, with other people who are interested. And my wife can only hear so much of this stuff.
I know. Same here. Oh my gosh, that's amazing. Well, thank you again, Dr. Derman. And thank you for the audience for joining this episode of the Sultans of Sales podcast. Tune in next week.